Hello, my name is Bill Smale. I've been living outside the United States for almost 28 years until coming back here to Arizona in 2003. My life has been spent setting up and managing new business ventures in Japan and Thailand. My views on life, business, and social responsibility have been shaped in countries where people really care about each other and where they spare nothing to make sure that everyone in society has a decent and civilized life. Doesn't that sound very Christian to you? It is. These are also attitudes that have come from thousands of years of Buddhist teachings. This year, the number of people we're throwing about concerning healthcare in the United States were somewhat confusing, the numbers at least, and also shocked me. The total cost of health care in the United States, $2.4 trillion, doesn't really hit home until they tell you that amounts to over $7,700 per man, woman, and child per year. The World Health Organization has rated the U.S. healthcare system as the worst among all developed countries and much of the developing world. America is not number one. We are the worst of 37 countries. Japan and Thailand both have some sort of universal health care for even the poorest in their countries. Japan only spends $2,400 per person to achieve this, and Thailand spends much less. Everyone involved in the discussions has brought forward a series of numbers that are used in all sides of the argument. When I saw these numbers as a businessman, I knew that the numbers would give me a good explanation and indicate a cost-effective path to the future. Two numbers stood out as the obvious partial solutions to U.S. healthcare costs. One of those is administrative costs. Now, understanding that somehow over 60% of all of the healthcare industry is somehow financed through some public funds, that leaves only 40% of the industry that is completely privately funded. If we implement the administrative cost savings of Medicare for only that 40%, we could achieve a cost savings of $265 billion a year. There are further potential savings in the public sector as well. Many people in the healthcare industry have been telling us that 30% of health care expenses are for unnecessary or unneeded procedures. This was also documented in a Newsweek article that came out this summer. Many of these unnecessary procedures can be attributed to a number of things: overpriced medications, overpriced treatments, overzealous professionals in the healthcare industry ordering procedures that are not necessary, defensive medicine, etc. Last week, for example, my neighbor in the countryside had a mild stroke. He was air-vac'd to Tucson Medical Center and had just over 2 days of treatment to find out what caused the stroke, which subsided the same day. He estimated that all costs totaled might be close to $75,000. His treatment included MRIs, CAT scans, and other various procedures. Being over 70 years old, he has Medicare coverage. Since he was in the civil service for a number of years, you and I paid the rest of the bill. 30% of $2.4 trillion is $720 billion. The only other number that is really significant is potential inflows that would come from the uninsured when they get coverage. Rewards from malpractice lawsuits and totals from emergency room treatments are insignificant and not even worth comparing to those numbers above. But if we take all the numbers and work vigorously on cost savings, we find that the true value delivered to the American people is only $1.4 trillion. That's a reduction of $1 trillion. $7,700 per person now becomes $4,400 per man, woman, and child per year. That is still double the cost of health care in Japan. There are only two ways that humans have proven to reduce those costs. One is a single-payer government finance system. In the United States, it would mean Medicare for all. This is not socialism because the people, through the government, would not own the industry. They would only manage the finances as they do currently with Medicare. The second way is to create a more efficient healthcare system through the private sector, but very heavily regulated as it is in Holland and Japan. Comparatively, there is virtually no control over the private healthcare companies in the United States. If that doesn't end, 80% of all Americans will eventually declare bankruptcy. If we go to a Medicare for all system or a very highly government-controlled insurance system or nonprofit, we can save almost $1,130 per family of four per month. Think about that. That is a house payment. Finally, all Americans will have the freedom to pursue happiness and prosperity. And, by the way, you may have heard about the recent Harvard study which proves that last year over 45,000 Americans died because they did not have affordable access to a doctor. I want to leave this thought with you. Under a civilized healthcare system, if you and I, as wage earners, paid for health care for those 45,000 people, it would only cost us $1.30 a year. That is the cost of one cheap hamburger. So look inside yourself and ask this question. Are you willing to make that contribution? I am, and so are most Americans. And if you're not willing to pick up the tab, then I care enough to pick up the tab for you. Numbers don't lie. It's time to get real and to create a system out of mayhem. It's time to stop shouting about what is not important and to show that Americans care about each other. I have discussed these issues with many people who call themselves conservatives, and I have repeatedly heard that they don't want to pick up the tab for somebody else. It is strange as well that every one of them also calls themselves a Christian. It is interesting to note that Japanese and Thai are more Christian than these Americans. Frankly, if that is the real attitude, then it's obvious to me that the United States is headed towards financial and moral bankruptcy. Maybe I'm stubborn, but I believe there is something very important in the words, the land of the free and the home of the brave. I am working, as are many, many other people, to turn this country's direction away from the land of the underdeveloped and poor and the home of the scared. So where do you sit? Are you going to get with the program and help America grow and prosper? Or are you going to contribute to the backward slide into bankruptcy?